Boy complains of jaw pain. Then dentists look inside his mouth and see 500 teeth. Most people do not enjoy going to the dentist. While we may enjoy clean teeth, we often don't care for the cleaning and flossing processes. The dental visit gets even worse if a cavity needs to be filled or some oral surgery is required. Children typically have a set of 20 teeth by the age 3 before they begin to lose them, while adults generally have 32 teeth. But what happens if you have more than that in your mouth? One child in India found out, to his dismay and the shock of his dentists and parents, that this was the case. Since the age of 3, Ravindrath, a young boy in India, had complained of mouth pain and swelling. He had gone to the hospital previously, but was so young at the time that he wouldn't cooperate with the doctors. Finally, at age 7, the boy's parents brought him to a dental college in Chennai, India, to discover what was wrong. The parents feared their son had cancer, and initial x-rays indicated that there was a tumor near the molars in his lower right jaw. Everyone assumed the worst, but the surgeons wanted to take a closer look. Further scans and x-rays followed. Then, Dr. Pratibha Ramani, the head of the oral and maxillofacial pathology at Savitha Dental College and Hospital, decided to see what was going on inside the tumor. The doctor could tell that there were hard pieces inside of it, but she wasn't sure what those pieces were. The doctor decided to open up the sac and see what was within it. What she found shocked her and her team completely. Dr. Ramani's team removed the 200-gram sac from the young boy's mouth. Then they cut open the pouch only to find that it contained 526 abnormal teeth. It took the medical team roughly 5 hours to completely empty the sac of all the teeth and confirm its contents. There were a total of 526 teeth, ranging from 0.1 millimeters or 0.004 inches to 15 millimeters or 0.6 inches. Even the smallest piece had a crown, root, and enamel coat indicating it was a tooth, Dr. Ramani said. According to the hospital, once the teeth were all laid out on a tray, the pathologist said the hundreds of tiny teeth were reminiscent of pearls in an oyster. Dr. P. Senthilnathan, head of the hospital's oral and maxillofacial surgery department who assisted Dr. Ramani with the surgery, said, "Under general anesthesia, we drilled into the jaw from the top. We did not break the bone from the sides, meaning reconstruction surgery was not required. The sac was removed. You can think of it as a kind of balloon with small pieces inside." Ravindrath had been suffering from a rare condition called compound composite odontoma. No one knows what causes this condition, although doctors suspect it is either genetic or due to environmental conditions, such as radiation. Compound composite odontoma is a rare defect where a benign tumor forms in the mouth, often due to the abnormal growth of one tooth. This tooth then causes the growth of additional teeth within the tumor. Without treatment, the tumor will continue to grow and swell, causing pain and discomfort, as well as difficulty swallowing and eating. Although most cases of composite odontoma have been found in patients' upper jaws, the 7-year-old boy in this situation had the tumor in his lower jaw. One can only imagine how much pain and suffering this young boy must have endured for 4 years. Doctors believe that the boy may have even had this condition before swelling was first noticed in his jaw at the age of 3. Dr. Senthilnathan says that the boy's condition is an example of why it's critically important that people seek help for dental issues as soon as possible. That didn't happen for this young boy. Would that impact his recovery? Thankfully, after 3 days in the hospital, Ravindrath was released to go back home. He is expected to make a full recovery, but his condition could have become dangerous if left untreated for much longer. Although awareness about dental health has improved in cities in India, that has not been the case in many rural areas where Ravindrath's family is from. Dr. Senthilnathan stated that earlier, things like not as many dentists, lack of education, and poverty meant that there was not as much awareness. These problems are still there. You can see people in cities have better awareness, but people who are in rural areas are not as educated or able to afford good dental health. More awareness is still needed in these far-flung areas, so more children with dental health issues can be relieved of their pain and discomfort sooner. The next time you go to your dentist for a routine cleaning or x-rays or even get a cavity filled, don't complain. Think of Ravindrath and imagine what it would be like to have a sack full of 526 teeth removed from your mouth. You will be earnestly thanking your dentists for his or her good work by the end of your visit.